This is a video demo showing how to assess the functional active movements in hand and wrist. The demo shows on right wrist and hand. Hand functional scan are designed to quickly assess any limited range of motion in hand by performing active functional movements of hand. You are going to check wrist range of motion first because the limited range of motion in wrist can affect the hand functional movements. After that, there are 5 positions in which the fingers move during hand functional scan: a standard fist, a hook grasp fist, a straight fist, palp to palp thumb to all fingers pinch, and tip to tip thumb to all fingers pinch. Ask your patient to perform the wrist range of motion like flexion and extension, and then ulnar and radial deviation. If you see any restricted range of motion or your patient reports any symptom during the motion, make a note on the chart. Now move on to the hand functional movements. Have your patient move to a standard fist position by flexing all the joints in hand simultaneously. To make a full fist, the flexor digitorum profundus should be able to glide fully with respect to the sheath and bone as well as over the superficialis tendon occurs. Next, have your patient move from open hand to the hooked grasp fist position by flexing the distal interphalangeal and proximal interphalangeal joints while keeping metacarpophalangeal joints extended. Maximum gliding of tendons are needed between the flexor digitorum profundus and superficialis and between the flexor digitorum profundus tendon and the bone. Next position is a straight fist. Have your patient move from open hand to the straight fist position by flexing metacarpophalangeal and proximal interphalangeal joints while maintaining distal interphalangeal joints and extension. Flexor digitorum superficialis tendon glides fully with respect to the flexor sheath and bone. These first 3 hand functional movements are necessary to have a power grip in hand, such as when holding a grocery bag, a cup or a golf club. Next 2 movements are to assess the precision grip of hand, like holding a pencil or threading a needle. Have your patient to touch the pulp of each finger onto the pulp of thumb, and then fingertips to tip of thumb. Record any findings from the hand functional movements. This is it. Thank you for watching.